Diagnosis of pancreatic disease can be bewildering for their patients and their families, but also for GPs themselves.
Life for patients with pancreatic cancer is a bit of a roller coaster. We recognise that people have trouble coordinating all their appointments, making sure that they get to their specialists on time, get to their x-rays, get to their chemotherapy or radiotherapy or whatever treatment. The Jreissati Family Pancreatic Centre will make this journey for patients a lot easier, a lot more defined. Now GPs will know exactly who to call. They will know that the centre will be able to direct that patient to the relevant specialist in the quickest, most efficient time. Part of the centre is that we have guaranteed that we will be seeing patients within 72 hours of referral. And that's quick. You know, people say, oh, we'll see you next week. That's a very long time to wait when you've got pancreatic cancer.
We strongly believe that a full-time clinical nurse specialist will be a really steady and calming influence to be able to be the first port of call when stresses develop, and it may well just be some reassurance or some education that's needed, but we do believe that that will really improve the quality of life of patients going through this journey.
I see my role with the Jreissati Family Pancreatic Centre as one of being that go-to person for the patient, meeting them at that initial presentation, gauging their needs, empowering them really to understand what they're going through, go over what their specialists have told them, what their treatment plan is, so that, you know, they're very included in their care and they can make their own decisions.
The complexity of management of pancreatic cancer is why it's so crucial that we have a centralised service with all the appropriate specialties available. We know that at some stage in the journey we'll need gastroenterologists, we'll need dietitians, we'll need surgeons, we'll need oncologists, we'll need pain specialists, we'll need endocrinologists, and eventually we'll also need pastoral care, palliative care and end-of-life specialists.
Pancreatic cancer patients obviously need a very high level of support from a number of practitioners to be able to manage all of their varying symptoms that do ebb and flow across their journey. There's lots of impacts of not only the condition itself, but actually the treatment that comes along with it that makes nutrition really hard going for most of our pancreatic cancer patients. It is a really big challenge for them, and it often comes around so quickly that it's a very hard thing for the person in the situation to adapt with.
At the Jreissati Family Pancreatic Centre, it's really important that families and the patients, the whole family unit, feel that they can approach us at any time. Myself in particular, I'm available to answer any questions, you know, knowing how often to take your medications, what is the chemotherapy treatment going to do to me, what time do I have to be at a certain spot, and where do I park the car. It's all of, you know, that nuts and bolts stuff that people worry about. So if we can consolidate all of that at the centre, I think we'll alleviate so much stress and pressure.